All right, folks, it's now time for Ask the Doc with Dr. William Whaley, and this is brought to you by the Georgia Cancer Research Center, affiliated with Northside Hospital. We appreciate them. How you doing, Dr. Whaley?
I'm doing great. Great. Where are your glasses?
My glasses on the end of the chair.
Okay, so make sure you can read the fine print for the questions.
I got the fine print.
All right, go ahead.
Read the fine print.
You got it blown up on a computer. That's what you got done.
Well, I didn't. Yeah, the fine print on my question, I did not. Anything? How are you doing? Anything before we open? Anything before the holidays? Are you traveling or anything?
No. We're good. We got family coming in. We're going to be. We have to go down to the Sin City there inside the perimeter because all the kids are coming in, and we don't have our big huge house anymore, so we're all holed up in hotels and having a real Christmas at my daughter's house for the first time in 53 years. That's how 53 years. That's how old my youngest daughter is. So it's the first time the Christmas will be in a daughter's house. How about
now,
that?
I want to check and see how my memory is.
Yeah.
Last Christmas, did you spend in New York City?
Yes, we did.
Just checking my memory.
Okay, you did good.
Huh?
Yeah, you did good.
Yeah, I thought so.
All right, and that's not
one of the questions.
Daughter that lives there, but we weren't at her house on Christmas. Okay, go ahead.
All right, here's our first question of the day. What is behind me playing, JR? JR's trying. Okay, it's fine. All right. Hey, in Circuit World, there's TVs, there's appliances, there's anything could be just start playing, right?
I hope the washing machine doesn't start.
If that washing machine starts, I'm ordering it. No, I'm ordering it now.
Oh yeah,
because I want the washing machine that just starts.
Okay,
I'm gonna place my order now.
Right.
I was recently diagnosed with thyroid cancer. What clinical trials are available for me? How do I find out more about them?
I'm going to answer the question kind of quickly and focus on the clinical trials, and then I'm going to go back and say that you shouldn't be particularly looking for clinical trials yourself. You got a great big old huge chart over there. Blow up the top part where there's about 10 on this page, but if you just look at the top of the page, what's that say right there? Got your glasses on?
Yeah, one of 10 of 267 studies.
Okay, so
you just have 1 of 10, but there's 267 different
267 studies. Okay, now this is just at the National NCC. We're at NCC, National Comprehensive Cancer Network. That's us. This is just in NCCN institutions. There are 267. Well, nobody is going to be able to make sense out of 267 studies on thyroid cancer going online, and the question sort of begs the fact that it sounds like somebody's medical team hasn't done a whole bunch of teaching to this patient with thyroid cancer, okay? So we're going to spend more time talking about thyroid cancer than where can I find a list of clinical trials, because those might confuse you if one of them, the first one says nivolumab plus ipilimumab in thyroid cancer, and then the next one says a study using regorafenib as a second and third line therapy in medullary metastatic thyroid cancer. I think that would confuse even you, BKP.
Yeah, I'm pretty.
And your people say that you're a really sharp knife in the drawer, but that's going to confuse you right there, right?
So are you? Okay.
You people say he's not the sharpest knife in the drawer. People say you're the sharpest knife in the drawer that you're in. So basically, at the end of the day, if that's going to confuse you, I'm going to tell this patient, you need to talk to your provider. That's number one. Okay, let's show that first. First thing is, where in the heck's the thyroid? So the first picture we got going up there, BKP, that looks like the guy's got his knot tied on his tie, doesn't it? Well, right underneath my tie knot, there's my thyroid. It's a little smaller than my tie knot, okay? And then on the right side of that, you see a little bump in the middle of the thyroid, okay? Let's go to the next one, guys. We're not confusing anybody here. So almost all, and we're going to show a thing here in just a minute, thyroid cancer. Let's see, 85 plus 12 is 97. That seems like a pretty high percent, right? So 97% of thyroid cancer is of the type of thyroid cancer that is generally localized, and the treatments are surgical. So this big old list of 267 clinical trials are for that 3% of thyroid cancer, which I'd be confident this patient doesn't have, that are not localized and surgically treatable, where surgery is basically the only therapy that's required for the primary treatment of the malignancy. You with me? All right, now, so that chart there shows a little bitty nodule, and I haven't seen a thyroid cancer in my practice in at least 10 years that wasn't either these two left-hand sides, one that's a little bitty thing, less than a centimeter, or one that's this big, or one that's that big. So all of these thyroid cancers, until it starts getting over here and eating the artery, which is almost never, are treated by total surgical removal. Now throw this next one up there that's got the classifications, okay? Basically, 85% of thyroid cancer is called papillary, 12% is called follicular, and both of those two are really similar in their genetics and in their development, and the malignant event here happened decades ago. It's not like rapid growing breast cancer or rapid growing lung cancer. And the one that you're likely to have the trouble with is the bottom one that's undifferentiated and only 3%. Okay, so you can get all that stuff off the thing. We'll talk a minute. So thyroid cancer is basically treated by surgical removal of the thyroid gland. Most of it can be treated by removing only the half of the gland that had that bump in it or the other bump in it. And unless there's something that's seen in the microscopic analysis of the tumor to suggest that it's penetrated or moved to a lymph node, you'll still have half of your thyroid. Now that's not like a lizard's tail where you can cut it off and it regrows. The liver is, as we talked a few weeks ago. If you go into the transplantation database, you may discover that your liver is a match for some 12-year-old kid in Paris that needs a liver transplant, and they can take just a seventh or one lobe of your liver and put it in that kid, and then your liver is going to grow back to its same size, and that 1/7 of your liver they've put in that kid is going to grow back to normal size. So that's like a salamander's tail. So your liver would get bigger, and then that transplanted one would get bigger. So I encourage you, go down and get your DNA tested so you can be a DNA donor or a piece of a liver donor for somebody anywhere in the world, and it won't be a tragedy. It won't be a big deal to donate either of those things. But anyway, when you take out half of the thyroid, the other half does not grow back. You have two women on your expert panel that have passed their third and fourth decade of life. Third and fourth decade of life is 20s and 30s. And the onset of low thyroid function is so common in females in that group that really women all their life, when they go see their primary care doc, have to have their thyroid checked, because a normal thyroid that still has both of those lobes wears out frequently. So once you have been diagnosed with thyroid cancer, even if they take out only one half, you are going to spend the rest of your life, not just the next 5 years, in the care generally of an endocrinologist who has particular interest and expertise in thyroid cancer. At some point, he will probably begin giving you thyroid medication. And this is the one place that I would say that our public is sort of misinformed or not thoroughly educated about what you can expect when you are taking thyroid medication. But do you remember me giving you an analogy one time about the furnace? and thermostat when we were talking about thyroid a year or two ago? You remember that analogy, I'm sure.
No, I don't know if I remember that.
All right.
I don't know if
we
I
got
remember
expert panel sitting over there. I mean, so here we go. We're in a store that's got all this stuff. All right, I want you to imagine that in your home you have a worn furnace in the basement. You have that thermostat set at 70, and the house is 68 degrees. In theory, you should be able to take one of these little voltage meter things you can see on the counter back there, and I think Josh has got one over there. Put it on that thermostat, and there will be a current going from that thermostat down to that worn-out furnace trying to kick it up to 70. You with me?
Yes, I do.
Okay, that current is thyroid stimulating hormone. So, if you insulate the house well, you build a fire in the fireplace, and the house is at 71 degrees, and you walk over to the thermostat with your voltmeter, no current's going to the worn-out furnace, right? House is 71 degrees. So, when you are taking thyroid medication, the way you know the dose is correct is not by measuring the temperature in the room, which means measuring your thyroid hormone level. It's by measuring the electricity from the thermostat called the thyroid stimulating hormone. I see patients every day in my practice that are taking bioidentical hormones or taking the thyroid product that's made out of grinding up thyroids in a slaughterhouse instead of the synthetic L-thyroxine or Synthroid, whose thyroid stimulating hormone level is in the normal range, and whose thyroid hormone level is in the normal range. And then the patient thinks, my thyroid treatment is proper because my thermostat's still putting out heat, putting out thyroid stimulating hormone. If your thyroid is appropriately replaced, your thyroid stimulating hormone level is below normal. Does that make sense?
Yes, it does.
Now, marijuana, we've talked about many times, has about 100 active ingredients in it. We only talk about one, THC, but the other 99 are biologically active. The thyroid puts out about 7 hormones, but the only one we measure in the blood is the T4, number 4 of the 7, because it's the highest number. So if your T4 is in the normal range and you're taking extrinsic thyroid and your TSH is high, those other 7 active ingredients aren't there, and your actual thyroid function is below normal. And then you may have trouble losing weight. You may still feel fatigued, and so you haven't gotten there. So this thyroid patient here clearly is not in the hands of an endocrinologist with interest and expertise in thyroid cancer, and secondly, hasn't been educated well because they're looking for clinical trials. And so my encouragement is, yeah, you can go online and find clinical trials, but that's not your job. It's the job of your team. Second, it looks to me like you haven't found the endocrinologist yet with their interest and expertise in thyroid treatment, and you need to go do that. And lastly, if you add up number 1 and you add up number 2, that number's 97%. 97% of this is just a nuisance because it's curable by surgery, seeing the thyroid doctor, taking the right amount of thyroid, and recognizing that just like you take your car to get the oil changed every 3,000 or 5,000 miles, you got to go see that guy every 3,000 or 5,000 miles, meaning once a year, and get your thyroid checked. Is that enough about thyroid? You heard all you want? Okay.
Okay. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. And our second question of the day, Dr. Whaley, as I was telling you before we came on the air, on the second question, I thought, well, this is just a pretty bland question. Just, I don't know. I just had to read this a couple times, and then it just really hit me. This is a very important question because to me, it's what I call what we walk around and don't realize. So our second question is what is the area of health people overlook most often?
JR, where's that soapbox you're supposed to bring me to stand on? Am I still in the picture when I stand up, Josh? I'm on my soapbox. This is a soapbox I get on every week, okay? Here.
No.
I mean, I hate to tell you, I did not write.
I did not see this coming. No.
I did not write this question. And whoever wrote the question either is a psychic, or they went on the website. No, this question came in on Monday, and this didn't hit the website till Thursday.
Yeah, because I get the questions Monday.
You got the question Monday. Okay, well, they were psychic then. Here are the top 2 of 800 medical news articles. What's the first one say?
New exercise guidelines urge everyone just move.
Okay, the next line says, this is only the second time Health and Human Services has released these types of physical activity recommendations. The original set was issued in 2008. Now, every time we've been talking about disease here, I've said exercise improves long-term survival with cancer, exercise improves long-term survival with heart disease, blah, 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 blah. Now, I'm going to read a little bit of this because I don't want to give any editorial emphasis to anything and blow it more out of proportion than it should be. But officials say new evidence shows a strong relationship between more inactive behavior and higher odds of death for any reason. Cardiovascular death, heart disease, type 2 diabetes. Now, but it did say, one more time, officials, higher odds of death for any reason. So people who are active have a lower death rate from everything except what? Accidents. Every other form of death, they have a lower death rate. Now, I have historically said that if you're not an exerciser, start walking 15 minutes a day, 5 days a week. When you've done that for 2 or 3 weeks and you've gotten good, you're not all, your shoes fixed, you got it all figured out, you go up by 5 minutes every 2 weeks until you reach 60 minutes. You walk 1 hour, 5 days a week, 60 minutes, then you start worrying about pace and distance and try to get to where you can walk 4 miles in an hour to an hour and 20 minutes, 5 days a week. Now, that's what I've said here for the last 3 years. Adults should do at least 300 minutes, 5 hours a week of moderate aerobic physical exercise. That is exactly what I've been telling you for 3 years. Or
yes, you have.
150 minutes, 2 hours and 30 minutes of vigorous exercise. That means jogging, or this guy that's out here on the bike in his tight pants or something like that, other than walking, okay? Or a combination of the two, and it's best if that is spread through the week. So that's that 5 days I've told you to walk. Okay, now you're not an older folks, but we have members of the expert panel who are older folks, okay? Older adults.
Leave him alone, he's on a soapbox.
I'm on a soapbox. Older adults should combine aerobic, muscle strengthening, and balance activities when possible. Now, I've said forever, once you get to 60, you need to be going to one of these places and doing Pilates. Have you the ball, learn how to sit on the ball.
Cub fan, are you doing Pilates once a week? You should be doing Pilates, Cub fan.
Standing back up, learning to stand on one foot. Okay, right, you got it? All right, because if you'll remember, if you watch the obituaries, they they routinely, in Atlanta, not here, they routinely will give you a cause of death in most. And you are going to be shocked, stunned, and amazed at the number that say died as the long-term consequences of a fall or died as the results of a fall. That's what you're preventing with the Pilates and with that ball, okay? So you fall, you break your hip, you get your hip nailed, you go to rehab, and 6 months later you die of pneumonia. That's still the hip fracture that got you because you weren't doing this. I'm going back to older people now. And if chronic conditions make moderate exercise challenging, you've got coronary disease or you got chronic obstructive pulmonary disease, be as physically active as you safely can. Well, over here at Fannin Hospital, over here at Riverstone, in the physical therapy department, they've got a full cardiac rehab program. So the guy with heart disease, the guy with lung disease can go in there and get a program that is safely done that will put them in this list here. All right, now, I've been complaining. I'm on my soapbox, Josh.
That's an Xbox. Don't use that.
All right, I know it. I'm not going to get the Xbox.
Not Xbox, soapbox.
Soapbox. I've been complaining about the kids spending so much time with their device, right?
Mm-hmm.
They're take it away from them at 8 at night so they don't text all night long. All right, I'm gonna let you read. Children
ages 6 through 17 need 60 minutes of moderate to vigorous physical activity a day.
All right, now, okay, what percentage of kids? Remember, we did this not long ago. What percentage of American kids meet that criteria? Remember what?
I don't remember the percentage.
6. What percentage of American adults meet that criteria up there? 12. All right, let's go back and read the question again. Read that question.
What is the area of health people look most often?
Well, I say when it's only 6 or 12% that are doing it, that is the answer to that question.
That's pretty factual.
That's pretty
numbers.
Factual. That's the numbers. All right, the expert panel waving their hands over there, but I'm on a soapbox here. Okay, now the immediate benefits from just one bout of activity. That means one exercise day lowers anxiety, blood pressure. What's that say?
Better sleep.
Ah, my goodness, better sleep. And improved insulin sensitivity. I mean, that helps you with your weight gain. All right, now, long-term benefits. Read that.
Brain health, lower odds of 8 types of cancer.
8 types of cancer. Read what it says in parentheses.
Previously 2.
All right, in 2008, the guidelines said this exercise will help prevent 2 types of cancer. Now they say 8. Now read the last of that part. Last chance, right.
Which one? Less chance of fall-related injuries in older adults.
By gosh, that must be that hip fracture and death.
Nursing home, pneumonia.
Right. Now, not one thing has been said about losing weight in any of this, has it? These are not recommendations that have anything to do with weight.
You know, if I was Rick, I would run out right now and sign up for the first Pilates class I could find.
All right. But read the last line.
And lower risk of too much weight gain. Why do I read these lines on live TV?
All right. Wait a minute. I'm not finished yet. What's the next one say?
With help with managing chronic health conditions.
Any kind, diabetes or anything else.
I got a feeling we're going to go on. Less pain for those with
osteoarthritis.
Osteoarthritis.
Okay.
Got it. Osteoarthritis.
Okay, wait a minute now.
Okay.
What's the first 2 words? Less pain.
Less pain.
Less pain.
With wait a minute. Whatever. Arthritis. Because I know a lot of people in pain.
Expert panel.
Pay attention over there.
Pain. Expert panel. Less pain for those with osteoarthritis. So when somebody says, I got a bad knee, I got a bad hip, I shouldn't be exercising, the Health and Human Services told you yesterday, exercise, it'll give you less chances of having pain in your hips and your knees. How's that?
No, that was great because I said, as I said earlier, when I first read the question earlier in the week, it was, hey, you know what? This is a big question as I was reading it, and it's pretty simple. It's move. Move. Get up and move. Okay.
All right. Well, we're going to touch briefly on the health things now. This is health news because you got to listen to expert panelists coming up now.
What's coming?
What's it say?
Study statins, benefits solid, side effects rare.
All right. Now, I've told you before.
Why do I feel like every quarter I'm going to get an exam from you, and the last question I have to do is an essay question? Why do I always feel like that? Is it?
You're the host here.
Statins. I'm reading.
You're host here. You got to be participating. You're my foil. You got Mutt and Jeff. You got Abbott and Costello here. So here you go. The clinical trials have been done that say, if at the age of 40, everybody with a normal cholesterol begins taking a statin drug, it will lower their cardiovascular death by 40%. One more time. Normal cholesterol, lower it by 40%. Now, and that's solid. So anybody with high cholesterol or coronary disease, peripheral vascular disease, benefits of statins are even greater. But the last words of that were
side effects rare.
People say, my hair fell out, I flunked English, I got arrested by the police or something, and it's all due to Lipitor, my statin drug. People complain most frequently about bone, joint, or muscle. Everybody has a bone or a joint or a muscle that bugs them, right? So when you're taking a statin, every time you got something that hurts, it's not the statin. And Health and Human Services tell you that muscular stuff is so rare that statins are 100% safe. And I hear the expert panel asking to get on here. So,
well, we don't have a green room.
Wait a minute.
We don't have a green room for them. Maybe we should just have a room. We don't have a green room for them, so anyhow. All right. So, Dr. Whaley, thank you very much again. Thank Georgia Cancer. I want to thank Georgia Cancer Research Center, affiliated with Northside Hospital. Before we go, is there anything else you'd like to share with the audience?
No, I want to give JR back his soapbox, though.
Oh, JR, you can have your soapbox back.
No, I did enough.
You did enough?
I did enough, yeah.
All right. Want to thank Dr. Whaley, and if you ever have a question for the doctor, you need to send it to me, info at fetchernews.com. Put in the subject line, ask the doc, and we'll get it to Dr. Whaley. Let's go take a brief break. Again, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital. We're going to take a break, and when we get right back, we're going to have the all-star political panel. Take us a break, Josh.